Welcome to another episode of the About Mansfield Consumer Advice Series. Another 10-minute nugget of information with right over here, Dr. Joseph Adams from Calibration, Chiropractic, and Functional Health. Welcome back to About Mansfield.
I'm excited to be back.
And we have been doing a series on, we started with migraines, and then we moved to concussions. If you want to go back and see or listen to any of those, YouTube, LinkedIn, Facebook, or your favorite podcast platform. Today, we start a new series. We are talking about vertigo and dizziness. And when I think of vertigo, I think of motion sickness. Mm-hmm. And I think of how I feel coming off a boat or even coming off an airplane that has some turbulence. Mm-hmm. Tell me what's going on inside my inside my body. Literally, this is something that I suffer with, especially on whether it's a cruise ship or even just a boat. That uneasy feeling could last up to a couple of days.
Yeah. So what's going on with that is, your brain has to interpret where your body is in space, all times. And it does this through the coordination of, eye input, so all the information coming from your eyes, your vestibular system, which is deep in your head behind your ears, and then all the joints and muscle receptors in your body. That's what kind of paints the schematic to your brain of where you're at in space. And anytime that's disrupted is when you can have dizziness or vertigo. And that sounds very much like what you're explaining, is that something has, basically trained your brain to think that, you are still on a boat, even though you're off the boat,
right,
or you're still on a plane, even though you're off the plane. And that's a neuroplastic change where the brain has basically been trained in a negative way to think that you're still moving when in fact you're not. And so your brain is not really recovering fast enough to realize that you're no longer moving.
How do I get over that? Is there a cure for that?
So that's a very good question. It really depends because there are many types of dizziness or vertigo. And so there's two main classifications for dizziness and vertigo. And, the first one is central. So central means that it's coming from, the actual brain, the cerebellum, or the cranial nerves. And then there's also one that's peripheral, which means it's coming from the vestibular apparatus that's deep in the head. And so you first have to figure that out, right? So is it central or is it peripheral? Now, central is much worse. And the central ones are going to be the bad ones too, usually. So it's going to be like if you have a stroke. Multiple sclerosis patients get, dizziness because of the disease. Migraine patients get it, specifically vestibular migraine patients. And then patients with ataxia, which is a kind of a movement disorder of sorts where there's like tremors. Okay. And so those are the central ones. Now, the peripheral ones are, easier to treat and less severe. The most common being BPPV,
which is
benign paroxysmal positional vertigo.
Okay, and explain to the listening audience, break that down, what that is.
So basically in your vestibular apparatus, you have these canals. You have an anterior canal, you have a horizontal canal, and you have a posterior canal, and they're semicircular shaped, and they're tubes. And in those tubes are little stones, and those stones hit hair cells in the tubes, and that is how your brain knows where your head is when you turn, rotate, and move. It's your body's own gyroscope, like you have on like on an iPhone these days.
Yeah.
And so what can happen is one of those otolith or crystals gets malpositioned in the canal, and it just taps that hair cell repetitively, and that makes people feel dizzy. But this one pretty much is only when you are laying in bed, getting up from bed, going from laying to, positions, things like that. So it's kind of an easier one to diagnose. It's also an easier one to treat.
Are there any other peripheral conditions that people should be aware of when it comes to vertigo, dizziness?
Yep. Another one that we see a good amount in office is just viral infections. So you can get a viral infection in your vestibular system and you will have dizziness, but it won't really match any type of pattern that you would see in other types of dizziness. And it can be treated with steroids to resolve the impact of the viral infection and or nausea medication. And those usually only last a couple of weeks with people, and they usually go with some other signs of illness as well. So that's a common one, not one that we treat, but we do see. Meniere's disease is another one. Usually people have a hearing loss associated with this. They think it's from fluid in the vestibular system, but they really don't know. It's one of these unknown type causes. This one is quite hard to treat as well.
And that's called Meniere's
disease.
And what is it, and what is it?
Well, they don't really know. That's the thing. They don't really know. But the suspicion is that there is fluid in the ear is one of the theories. Sometimes upper cervical chiropractic care does a really good job of treating this one as well. But it is one of the more hard ones to treat.
What causes let's get into the causes of dizziness and vertigo. What causes it?
So it really just depends on what form you have, and it depends on where it's at in the brain or the brainstem or the peripheral neurology. And so that's what we got to figure out, right? And so, we explained BPPV, we talked a little about infection, we talked a little about Meniere's, but, one of the more common ones that we see is vestibular hypofunction, which is really just a neuroplastic change to where, let's say, one vestibular system is not really firing the way it's supposed to. So maybe it's not firing enough or it's firing too little. And that can cause people to feel dizzy as well. And that one can be rehabbed. And so that's one where you can see a practitioner like me and we can rehab that condition with eye exercises and or vestibular exercises. That's one of the more common ones. And then probably the number one thing that I see that a lot of other practitioners don't understand or treat is called cervicogenic. Cervicogenic. Coming from the neck.
Ah, gotcha.
Right,
okay.
Right. So it's when somebody has a very tight neck and or a very degenerated neck, and because the neck is tight and degenerated, it's sending bad information from those sensors in the joints and the muscles up into the brain, and we're getting a mix, like a mix match in the brain of where the neck is in space compared to where the eyes are and where the vestibular system thinks it is, and so it's like a short circuit, and they're dizzy. And usually those patients are going to report dizziness in certain head and neck positions, like maybe it's very specific for them looking down and to the right or going, backwards and to the left. And you just figure it out from, an exam, thorough history, that's what's going on. And then you just go to town on, loosening up the neck, improving the neck health, and then improving, the eye and vestibular system at the same time. And that's why you can, help people with cervicogenic dizziness.
Can a chiropractic doctor determine, you went through several conditions of BPPV, infection and disease, and hypofunction, the cervicogenic. So can a chiropractic doctor determine which one of those five it is before going in on treatment?
Yes, yeah, it depends though. In chiropractic school, you are taught basic neurology and neuropathology, and I would say most chiropractors have been trained to some degree to understand if it's BPPV and how to resolve it. But I would say that you really need to see somebody who has extra education in this topic, and those are the ones that are more well suited to treat this type of condition. Mm-hmm. And so for myself, having a master's degree in applied clinical neuroscience, and not only that, but actually working in an integrated facility with other practitioners taking care of conditions like this is really helped me over the years at niching into this type of treatment paradigm and helping patients with these conditions.
In the minute or so that we have left, is there anything that you want to conclude on this regarding vertigo and dizziness? How, maybe a recap, or how someone can reach out to Dr. Joe?
Yeah, so vestibular issues that cause vertigo and dizziness are very scary, and some of them are very serious, and you should be evaluated as quickly as possible if you have one, because it could be a stroke or something worse. But other ones are more subtle and not as dangerous, and so just make sure you do your due diligence when you have dizziness and get seen by providers. But know that a lot of providers, if it's not a major issue, may not be able to help you with the more subtle and less damaging conditions, and that's where people like myself and Vestibular PT can come in and help with these conditions. You can find us on at calibrationmansfield.com, and a Google search will be more than enough to find any content on this or any other topic that we treat in our office.
Calibrationmansfield.com. And I don't have any boat rides in my future that I know of, but I'm going to go back and reference this episode in the next time I come off of a cruise ship, and if I still got the little dizziness going on, I'm going to refer back to this. I appreciate Dr. Joe, you being on the About Mansfield Consumer Advice Series. Let's do it again real soon.
Let's do it.
We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.